I'm Janie Marbo with Inspired Hygiene. Occasionally we are challenged with questions from our patients, especially when we are proposing treatment. Questions like, "You've never told me this before," or "My gums never bleed at home," or "How come I have this disease and nothing hurts in my mouth?" So one of the things that we have found with Inspired Hygiene is that the soonest that we have the patient involved in the information and the gathering of the data and have them be a part of the process, the sooner that they will learn to take ownership for their own health and or disease in their mouth. So one of the things that I want to work with and give you tips on today is the probing piece. I go through, and what I do is I'm going through and gathering my information, and when I get to the probing piece, I say, "Mrs. Jones, I'm now going to take my little measuring device. I'm going to gently measure the bone level around your teeth and check the tissue health and the supporting structures. I'd like you to listen as I go around because I'm going to be calling out numbers. As I call them out, I want you to pay attention to the lowest number and the highest number, and then we're going to discuss those. Also, I want you to know that 1 to 3 is normal and that healthy gums don't bleed." So that is telling the patient exactly what it is you want them to listen for, what it is that you are looking for, and also it puts them the thought in their mind as to what's going on in their mouth every step of the way. I then get all of my recordings in, and then I print a colored copy of the probing sheet. It looks like this. I set Mrs. Jones up, and then I say, "So Mrs. Jones, you heard the numbers. And what was the lowest number? What was the highest number?" And I let her respond. And I ask her if she is concerned about any of that and what she thinks. I also ask her about the bleeding, and I ask her to even rate herself. Do you think that the amount of bleeding you heard and that you saw with the patient mouth mirror that you had in hand, did you think you had slight bleeding, moderate bleeding, or heavy bleeding? And I let her rate her own disease, because sometimes our thought process of bleeding and what's a little and what's moderate or more is based on the type of patients we saw that day. So her bleeding may not be as severe as Mr. Jones was before that, but it's still in her mind, it needs to be said out loud. And then she's put the attachment of the disease on herself. So then I take the sheet and I go down and I put it into quadrants. I circle the teeth that I know we're going to be probably treatment planning therapy on. And I put that number up here. And the patient's watching me because she knows that we are now trying to treatment plan the special type of cleaning that she is going to be needing and the therapy she might be needing. And then when the doctor comes over, I alert the doctor. He sees the probe sheet and he already knows a heads up by looking at it that we're probably going to be proposing some type of therapy on Mrs. Jones. I also then ask the patient if she's ready to move forward with treatment. I invite her to accept the treatment plan and move forward with it. So I hope that this little tip helps you get your patient to accept their own disease and take state claim in what is going on in their mouth. Thanks, and stay inspired.